The 2021 AUA Virtual Meeting has been underway for a couple of days now, and today is another day bringing you all the latest in urology and urologic care right from your home. My name is Autria Godfrey, and welcome to episode 3 of AUA TV. Today we are going to be continuing our tour of organizations and medical centers that are leading in the field of urology. Hearing from our rising star lecturer, Dr. Salami.
I really feel humbled as well because I hope that I'm able to live up to the expectations of this award. It is said that to whom much is given, much is expected in return.
And highlighting a few of the plenaries taking place today.
During this plenary session, we'll go over the 52 guideline statements that provide special emphasis on the use of counseling for men with male infertility.
First, let's stay in the studio for our conversation with Dr. Salami. Thank you so much for joining us in the studio today, Dr. Salami.
Thank you for having me. It's a pleasure to be here.
So how does it feel to be one of the Rising Star Award winners?
I feel very privileged to be chosen for the Rising Star Award. I also feel very humbled because many of my contemporaries are well qualified for this award, so it is really a privilege to have been chosen. I really feel humbled as well because I hope that I'm able to live up to the expectations of this award. It is said that to whom much is given, much is expected in return.
Can you briefly tell us about your work on radiogenomic characterization of prostate cancer?
MRI is used in the evaluation of men for prostate cancer. While MRI is very good at picking up high-grade prostate cancer, it can miss high-grade disease. It is estimated that in about 10 to 15% of men with negative MRI, they may harbor high-grade prostate cancer. So the goal of my research is to discern the molecular basis for prostate cancer invisibility on MRI and develop strategies for detecting such cancers using urine molecular assays.
And what is it that you hope people will take away from your research?
I hope that people recognize that MRI invisible high-grade prostate cancer are just as important as MRI visible ones, and that tools that can overcome prostate cancer heterogeneity and multifocality are needed to optimize or prioritize the detection of high-grade disease.
What kind of impact do you hope that your research will ultimately have for patients?
My hope is that our work and those of others will lead to the development of non-invasive tools such as urine molecular tests for the evaluation of men at risk for prostate cancer. Such tools can minimize the need for unnecessary prostate biopsies and prioritize the detection of high-grade prostate cancer that need to be treated.
Dr. Salami, once again, congratulations and thank you for your time today.
Thank you. It's my pleasure.
Congratulations once again to Dr. Salami for receiving the Rising Star Award. Let's dive right into our tour of leaders in the field of urology. Complicated urinary tract infections can be debilitating to patients, and they're a high burden on healthcare professionals and the healthcare system. Their frequency of recurrence often leads to chronic pain and bladder dysfunction, and in some cases, potential life-threatening complications. Spero Therapeutics aims to allow urologists to avoid unnecessary hospitalizations and efficiently shift care from the inpatient to the outpatient setting, something that would be good for the patient and good for the healthcare system. Let's take a closer look.
My background is urology, and I've done a lot of things in infections in urology. Really, in the last 2 decades, there's been a marked change. The level of resistance in the community to the antibiotics that are available has risen substantially.
Millions of patients who otherwise might have been perfectly well treated at home for their UTIs are now required to have IV therapy. What we want to be able to do in CUTI is find better options for them so we can go back to treating them the way that we're used to doing it.
At a time when many of the larger pharmaceutical companies have decided to discontinue the development of new antibiotics, Spero's moved forward aggressively in this area.
I worked with Spero on the advisory committee for urology. I've been glad to see a new option for us as urologists to use for our very complex and difficult patients.
Next, let's take a look at Alina Pharmaceuticals, a public biotechnic company that is focused on the development of novel oral enzyme therapeutics to treat patients with rare and severe metabolic and kidney disorders. Alina Pharmaceuticals are trailblazing a pioneering technology. Let's take a closer look.
This is truly an exciting time at Elena Pharmaceuticals. We are trailblazing what we believe will be the first FDA-approved treatment for patients with enteric hyperoxaluria.
At present, there are no FDA-approved pharmacological therapies to treat enteric hyperoxaluria. Our goal here at Elena is to change that.
There are roughly 250,000 patients in the U.S. alone, and they suffer from debilitating kidney stone episodes, chronic kidney disease, and can even lead to end-stage renal disease.
We have made significant progress and are really in the home stretch running a confirmatory second phase 3 study that will be used as the basis for filing for FDA approval and hopefully bringing to market the first-in-class therapy to treat patients with enteric hyperoxaluria.
We innovate with the utmost care and consideration for the patients that we serve. It's our mission and it's our purpose.
Now we go to Minnesota, where the University of Minnesota's work with transgender patients is bringing attention to this marginalized population to help more broadly address an element of health equity.
Here at the University of Minnesota, we provide really comprehensive urologic care to the complete spectrum of urology patients.
Our goal is to have a broad, comprehensive gender care center here with the full array of surgical options.
A third of transgender patients claim to have experienced discrimination in healthcare systems.
So one of the things I've appreciated about the U is that they have absolutely taken into account the outcomes and the body that I want to be able to have.
Lots of different groups of people start out at different places due to structural inequalities in our society, and we need to make sure that we are providing the adequate resources such that everybody has the same outcomes and not just simply applying the same inputs to everybody. And this is our focus at the University of Minnesota.
If you haven't had a chance to look at what today and tomorrow's plenaries are about, stay tuned as we will be hearing from the speakers themselves.
Hi, I'm Lori Lerner. I am the current chair of the Bph Guidelines Committee and an associate professor of urology at Boston University School of Medicine and the chief of urology at the VA Boston Healthcare System. During my plenary presentation, I will be presenting the updated Vph Guidelines. They were last completed in 2010. We did have an amendment for the surgical management that came out earlier, but this is the full set, including medical management and workup, as well as the most recent surgical management as well. So it's all concise and all going to be presented at my plenary session.
My name is Nelson Bennett from Northwestern University. On Sunday morning, we will be presenting a panel discussion on COVID and sexual medicine. During this session, we will highlight COVID's relationship with erectile dysfunction, hypogonadism, telemedicine, as well as infertility. Please join us.
It is a privilege, on behalf of my fellow investigators, to present the clinical and scientific story of a new sublingual vaccine for the prevention of recurrent urinary tract infections in women. In this late-breaking science abstract session, I will be outlining the mechanism of action of this novel sublingual vaccine, which is self-administered. I will describe the results of 5 European observational studies which show the effectiveness and safety of this, including comparator to antibiotics. It does show a statistical and clinically significant decrease in incidence of recurrent UTI in women with a median of 6 UTIs pre-vaccination. This novel sublingual vaccine will be a game changer in the management of recurrent urinary tract infections in women.
Hi, this is Peter Schlegel from Weill Cornell Medicine, and I'll be presenting the Male Infertility Guidelines summary in a plenary session. During this plenary session, we'll go over the 52 guideline statements that provide special emphasis on the use of counseling for men with male infertility. Male infertility is not just a disease by itself, but it has other health implications, and that's part of what the guidelines overview. It's also going to talk about evaluation for right varicoceles. In the past, men would typically have abdominal imaging for right varicoceles. The indications for that are now limited and specified. We're also going to talk about the role of varicocele repair in management of male infertility, and the role of adjunctive treatments for management of men with the most severe forms of male infertility, such as non-obstructive azoospermia. We're also going to talk about the surgical treatment for non-obstructive azoospermia, microtesting. Finally, we're going to provide new clinical guidelines for management of men who are undergoing cancer therapy or recovering after cancer therapy.
Let's continue our tour of those leading in the field of urology. This time, we head to New Jersey, to the Hackensack University Medical Center, who's pioneered the use of robotic-assisted surgery to treat prostate cancer for over a decade. Let's take a closer look.
Hackensack University Medical Center is the flagship hospital of Hackensack Meridian Health. We are the largest healthcare delivery program in the state of New Jersey. We've learned a lot, and I think that most proud of with our department is that we're sharing that knowledge, that we're publishing on our data, we're teaching others, we're educating other faculty as well as other departments throughout the country on how they too can take this technology and get the best benefit out of it.
The Center for Prostate Disease Research, or CPDR, is designed to be the Department of Defense's Prostate Cancer Center of Excellence. Their goal is to provide translational and basic science research to understand the disease. Let's take a closer look.
We get to take care of those that have served this country honorably, and we want to give back to them our best because they have given us their best.
So our institution is committed to bridging the gap in health disparities. The high representation of African American men in the military provides a unique opportunity to address health disparities in prostate cancer.
Ideally, we would like for our patients to feel the embrace of a family that cares for them, and that cares for them wholly and holistically.
Through generations of research within our team, we've developed a better understanding of how prostate cancer can be identified and treated. Our goal is to find truly personalized prostate cancer treatments for each of our patients. With personalized prostate cancer treatments, our goal is to have our patients have better outcomes, satisfaction, and quality of life.
Now let's head to Fort Worth, Texas, where the Cook Children's Medical Center is part of a nationally renowned pediatric health system. The hospital has 444 beds and more than 400 employed physicians that provide advanced therapies in more than 30 specialties and subspecialties.
Here at Cook Children's, our pediatric urology program is known for our work with our multidisciplinary teams, specifically nationally recognized for our congenital adrenal hyperplasia program with the endocrinology department and our spina bifida department.
My role in the spina bifida clinic here at Cook Children's is focusing primarily on their function. So helping them with their mobility, helping them with braces, equipment, therapy.
We know that people with chronic illnesses are at risk for maladaptive coping skills, stress, anxiety, depression. So it's important that within the healthcare system we're providing that behavioral health support.
Collaboration is extremely important. A lot of my interventions are based on decisions that the physicians and surgeons are making with the families.
I get to help families and kids understand how urologic problems are affecting their life and what options and things that we can do that can help improve their health and hopefully their quality of life.
Well, that is it for us here at AUA TV. We hope you've enjoyed our program and that your virtual meeting experience has been an excellent one. If you missed any of our programming, make sure to visit it on the platform, the app, or on YouTube to catch some of our exclusive content about the 2021 AUA Virtual Meeting. We'll see you next year.